GV Black classification of caries. Tooth decay, also known as a cavity, is a bacterial infection that leads to the breakdown of the hard tissues of the teeth, including enamel, dentin, and cementum. This condition arises when bacteria ferment food particles left on the tooth surface, producing acids that demineralize these tissues. If the rate of demineralization surpasses the natural remineralization processes, which involve saliva and the restorative effects of calcium and fluoride from toothpaste, the enamel progressively deteriorates, resulting in dental caries, class 1 lesion. All pit and fissure restoration are class 1, and they involve the following 3 location groups. The occlusal surfaces of the molar and premolar, the occlusal 2/3 of the buccal and lingual surfaces of molar, the lingual surfaces of anterior teeth. Class 2 lesions involve the proximal surface with axis established from the occlusal tooth surface. Class 3 lesions involve the proximal surfaces of the anterior teeth, which may or may not involve the lingual extension but do not involve the incisal line angle. Class 4 lesions involve all proximal surfaces of anterior teeth, which also involve the incisal line angle. Class 5 lesions involve the cervical third of all teeth, including the proximal surface of posterior teeth, where the marginal ridge is not included in the cavity preparation. Class 6 lesions involve the incisal edge of all anterior teeth and the cusp tip of all posterior teeth. Thanks for watching. Please like, share, and comment for more informative videos.